Hello everyone. Today we're going to be discussing cholesterol. We're going to be talking about the pros and cons of both high and low cholesterol. We're also going to talk about the most common misconceptions about cholesterol. We're going to tell you how you can discuss this topic with your doctor in an educated way and the questions that you would need to ask. We're also going to tell you how to manage your cholesterol in a natural way. This video is meant to empower you so that you can be your own health advocate and that you can make educated decisions when it comes to this particular topic. To help us bust some myths on cholesterol and to educate us further is my father, Dr. Phil Pappas, who has a PhD in nutrition, a master's in psychology, and a background in pharmacology. Thanks for joining us today, Dad.
Well, thanks for having me.
Let's start with why do our bodies make cholesterol and how important is cholesterol?
Okay, so cholesterol is an interesting subject, and we're going to give you the low cholesterol story and the high cholesterol story. You make up your mind from the information and see where you can go from there. If you're having a cholesterol problem, though, you really should listen carefully and maybe have a good discussion with your doctor. Mm-hmm. So after you hear this information, you may be able to talk to your doctor in a more effective way.
Right.
So why do our bodies make cholesterol? That is the core question. Our bodies make cholesterol because we need cholesterol. So when we're looking at too much cholesterol, you shouldn't have cholesterol, you should have cholesterol, you need cholesterol. So right away, you start to feel this kind of an antagonism, about the cholesterol story, high cholesterol, low cholesterol. You need cholesterol to stay alive. You can't live without it. Your body needs to make it. So the very membrane around each cell in our bodies these cells keep us alive, literally. They create the whole function so we can build energy and do all the functions the body needs to do, keep the heart pumping, the brain working. Has to have that lipid membrane, lipid meaning fat membrane, around each cell. It keeps that cell healthy. Mm-hmm. The only way to get that membrane is with cholesterol, and your liver makes that cholesterol. Now, cholesterol pretty much is what your body is. Everything is built from cholesterol. Soft tissue, everything. All your hormones are made from cholesterol. Vitamin D is produced with cholesterol. Yes, sunlight, foods, whatever, but you've got to have cholesterol to get that together and make vitamin D. These are life-saving issues. So cholesterol in your blood comes from two sources. For the most part, food isn't much of a source of cholesterol in the blood. The liver makes cholesterol, and that's what you're looking at in your blood work. Because if you try to diet out all the fat in your system, it probably isn't going to lower your cholesterol very much, 3%. And you take a huge risk of the body noticing that you have a low cholesterol, and the liver starts making even more cholesterol. Mm-hmm. So you could actually raise your cholesterol by being on a low-fat diet. So there's a reason for cholesterol. We need it. It'll save your life, and it's extremely important.
That's so interesting that our bodies are composed of cholesterol. It's this essential thing that our bodies make, yet all we hear in the media is that it's bad for you. Don't eat eggs, it'll raise your cholesterol.
It's the most perfect food.
Right, one of the most nutrient-dense foods.
Who says that?
It's crazy. Speaking of eggs, does dietary fat increase cholesterol?
Okay, it's a complicated question. I'm going to break it down into its constituent parts. Generally speaking, the food we eat that contains cholesterol does not affect those numbers that you see on your blood work. However, eating saturated fat is important because it does increase the amount of LDL in our blood, at least temporarily. And LDL, low-density lipoproteins, are very healthy proteins. They build our immune system. They protect us from cancer and other diseases. So LDLs in and of themselves are healthy. You need to look a lot closer at this picture, because you can break what you see on your blood work at the average blood work that the physician gives you tells you HDLs, which are very protective, and we'll talk more about HDLs, LDLs, and total cholesterol. In my experience, I don't know what total cholesterol means. To me, it means nothing. I never look at the number. I look at HDLs. Are they high and healthy? I look at LDLs. Are they excessively high? Are they a little too low? Or are they in the healthy range? But then I realized those two things are nice to have, but you've got to break down LDLs a lot more. And what we really want to look at from a point of view of, am I healthy or not? If you, let's say you get your doctor calls you and tells you, you have a 225 cholesterol. In my book, and the way I work, he just told you nothing.
Mm-hmm.
Because you need to know what LDL, HDL, and what VLDL'S are about.
Yeah.
VLDLs, very low density lipoproteins, are dangerous. And there's clearly on your blood work a chance to look at that number and see if you're healthy or not. And if the doctor doesn't do the test, then you don't know. Got to ask for your VLDLs. Very, very important. Are your HDLs in a healthy high range? Because HDLs take that VLDL, the bad cholesterol, out of your body, process it through the liver, and it's gone. And you stay healthy, cardiovascularly healthy. So this is very important. Also, when you see your doctor, maybe this is a good time to put this in here. There's other tests that are important here that apparently, if the doctor just tells you the total, he may not have done these other tests. So C-reactive protein, that is not my favorite test, but I like to see it. I don't say don't do it. I want to see if we have inflammation. That's what C-reactive protein tells me. Shouldn't be a lot of inflammation. It's not good. People should not have inflammation. Mm-hmm. So you want to know that. Homocysteine. Is your homocysteine level normal? If not, you should know that, because that is an indicator of real heart problems. Very, very important. Calcium score. What is the calcium score in your blood? If it's elevated, that's dangerous. And you should know that. And the doctor should do that test and tell you that. And they usually do. Triglycerides, it's always done. But it's like, unless it's elevated, there's no, it's not important to anybody. You need to have good, healthy triglyceride numbers that are low. Mm-hmm. If you're up at the top end all the time, you're flirting either with heart disease or type 2 diabetes or both. It only, and triglycerides can go up in a week, and you can correct them in a week. Can't correct cholesterol numbers quite like that, maybe 3 or 4 months. So there's another test that you should be aware of. What is your triglyceride numbers? And you have one of the most amazing triglycerides I've ever seen. I think it was 32 on your last test, which made me stand up and think, wow, that's pretty good. I thought I was doing all right at 68 or 70.
I got a round of applause.
Wow. So, and you don't eat a low-fat diet. So that tells you something right there. And let me throw this in. We talked about these tests. We'll probably mention them again. Fat. Fat's good, fat's bad. We're not here to try to sell you that concept. If you want to think fat's bad, good for you. If you want to think it's good, that's good too. Mm-hmm. Drug companies are selling fish oil to lower triglycerides and cholesterol. What is fish oil? Saturated fat. Now, at least 3 or 4 companies are selling fish oil. Very expensive. It's probably pretty good quality. Actually, it's roughly the same as any off-the-shelf health food store good fish oil. Mm-hmm. why are they selling you fat if fat's bad for you? Saturated fat in
Right.
particular.
Right.
So think about that really hard, because it puts pressure on cholesterol story and the fat story and saturated fat story in particular. So let's keep that in mind, and we'll probably talk about that a little more as we go on.
Right. So to summarize what you just said, you have to look at the bigger picture when it comes to your cholesterol.
And you've got to know those numbers.
And you have to ask those questions. What's my VLDL? What's my LDL? What's my HDL? And the, homocysteine and triglycerides and calcium and all those things. People don't realize that. They just think cholesterol, and it seems like the doctors think, oh, it's just that total cholesterol number. They don't discuss the other things.
He asked me what tests need to be run. And I just tell him, and he's perfectly happy with it. A lot of doctors really don't do these other tests. And I honestly, some of them aren't covered by insurance.
Right.
So you have to pay $60 extra for homocysteine, but it may save your life. So calcium is usually on there. Let's see, C-reactive protein may not be on there. Oh, and we missed another one, so I'll throw it in right here. Lipoprotein a. That test is often done, and I don't know if the patient always gets to hear what that number is, unless it's highly elevated. It's a stroke marker. There's another one you need to do. So you got to really know what you want when you go into your doctor and get the numbers, find out.
Right.
And a doctor should be willing to work with you. Shouldn't be a problem. My doctors say, well, what else do you want?
Right.
I tell them which tests to do. What else do you want? I might throw something else in. And when we get it back, we sit down and discuss it.
Right. Education is power, and this is where you become your own health advocate, and you can ask further questions, and you can ask for things. And you shouldn't feel afraid.
You're paying to have yourself treated.
Yeah. You just need to be educated.
And diagnosed. You need to walk in there knowing what you want, what you're looking for.
How does the body get rid of cholesterol? What is the process?
Okay. So it's done by your liver with the help of high-density lipoproteins, HDLs. And the more HDLs you have, the better it is.
The more efficient it's going to work.
There's no argument. The higher your HDLs, the better it is for you. Every study shows that. And if there are studies that don't show it, then they were done badly. Because HDL is a cornerstone of good heart health. So HDLs gather up, I guess you could say in a way, bad cholesterol. It takes it to the liver processes it and gets rid of it. And people with high HDLs don't usually have heart disease. People with high HDLs live long, healthy lives. And I'll just throw out, I've seen 110 number for HDL. I believe anything over 50 is great. My mother had a 94 HDL and died at age 94.
Wow.
And over the years, I've been asking and looking at those people that have high HDLs and keeping track of things. And it's age 85 is nothing for somebody with good, healthy HDLs. It's an important factor. So that's how you get rid of cholesterol. If you try to diet it away, you may increase more cholesterol. You may drop your HDL. And drugs may drop your HDL if you try to lower your cholesterol. May drop the HDL, making you less and less able to get rid of bad, small density lipoproteins, which are what scars and damages the lining of your blood vessels and your heart and your brain. So don't try to diet it away. Don't try these low fat diets because they tend to be high in sugar usually. Maybe too much protein. Fat's the better fuel. So stick with that idea, and we're gonna learn some more about that also.
Right. So don't diet it away because it may backfire on you.
You want to raise your HDLs, just start taking a couple tablespoons of olive oil every day. That will help. No drugs do that very well.
So I just got my blood tested, and the doctor called me up and was concerned because I have high cholesterol, according to her. Obviously, I eat a very healthy diet. So why would somebody who eats a healthy diet have high cholesterol?
Okay, so that's another part of the story that can be in and of itself a kind of a different issue. You could have really high cholesterol and not be well, or you could have really high cholesterol and be well. Just depends on your genetics. You may not be able to lower that high cholesterol, and it may not matter. All right, so again, if your high cholesterol comes with high HDLs, you really shouldn't be worried. And if you bother to test VLDL'S, if they're low, then that cholesterol number is meaningless. The office called and told you have a 216 cholesterol. That's all they said. Mm-hmm. Well, they mentioned your LDLs, and they didn't even tell you your HDLs, did they?
No, they said they're going to mail it.
Yeah. Well, they didn't tell you anything. Mm-hmm. They give you no information. And by the way, 216 is not particularly serious. Also, what's your history of heart disease? None.
Right.
What's your family history of heart disease? None. So they're the questions that you should be, that your doctor should be asking you.
Right.
How old is your mother? How old is your father? When did they die? You want to know those things. That's something that's important to talk to your doctor about.
Right.
Is dietary cholesterol a problem? It can be in some people, and that has to be treated in a different way.
Right.
But for the most part, it's not an issue.
Right. And it can be genetic too, because you have high cholesterol, and then I have high cholesterol.
Yes. I've had high cholesterol since first time I ever checked it.
Right.
When I was 16 years old, I think.
You've had high cholesterol your whole life.
It was 250 then.
Yeah.
And my VLDLs are very low, and my HDLs are very high.
Right. What does it mean if your doctor says you have high cholesterol? Like, what exactly does that mean? What questions do you need to ask them?
Okay. So you're going to ask, do I have heart disease? He may not know that. In fact, he probably won't in most cases. Do I have low VLDLs? Is my homocysteine normal? They're the kind of things you want to ask. However, remember that for some people, they develop hardening of the arteries. Atherosclerosis is the lining of our blood vessels getting thick. So we don't want that. And some people will have a tendency to do that. The story has been cholesterol did it to you. However, I think most cardiologists today are saying, well, it seems like inflammation did that. Sinatra and a whole bunch of good cardiologists out there with that story. And it makes a lot of sense because we know that for the most part, people with high cholesterol live slightly healthier and longer lives than people with low cholesterol. So it does put a kink in the cholesterol story. Mm-hmm. So yeah, you should be aware what's going on and what's the conclusion. Am I in danger or aren't I? But you got to look at those numbers, and you got to look at your family history and your history.
Right.
And there's other tests that can be done, by the way, mm-hmm. on the blood vessels, blood flow. What's your, are you overweight? Are you drinking? Are you smoking? Or are you a healthy person? Mm-hmm. A lot to talk about.
It is a lot to talk about, but these are the tools that we need to be equipped with when this topic comes up so that we can mm-hmm. have a conversation with our doctor, an educated conversation with our doctor. Can low cholesterol diets help?
Well, it's very hard to diet away your cholesterol because the food cholesterol really doesn't have much of an effect on the overall cholesterol numbers. In some people with excessively high cholesterol, maybe a cholesterol diet would work. but you always run the risk of the body recognizing that you're not eating enough cholesterol, and your liver may start to make even more cholesterol.
Mm-hmm.
So you've got to be very careful with that. Low cholesterol diets, unfortunately, in the studies, have never proven to be very effective as far as heart disease, as far as longevity and mortality, heart attack. The evidence just doesn't show that a low cholesterol diet is that helpful for most people.
Let's talk about the studies about cholesterol.
Okay, so just to get this started, when I was at a teaching hospital locally where I worked for a long time, I was working on this cholesterol thing. I think the year was around 99, 2000. And we have a very large, as a teaching hospital, a large medical library. So I went over to the library one day, and I asked the librarian to do a search for me of all of the studies that show cholesterol, or high cholesterol, is not a problem, in fact, may be good for you, and all the negative statin drug studies. And she kind of laughed and said, well, that won't be very many. And about a week later, I got a packet delivered to our office from the library. It was about 3 inches thick. Yeah, so I started digging into the studies, and it confirmed what I already believed. And I had already been lecturing about the dangers of low cholesterol. I never really talked much about statins, but we will today. But the studies are pretty clear. And the one study that kind of, there were a lot of studies out there from 95 to 2010. And they were all pretty good studies, but small. In 2011, there was a VA study done. And in that study, it showed a couple of things. It showed that statin drug had very little effect on longevity and heart disease. It also showed that people that live to 85 and older almost always have good quality HDLs and no significance when it comes to total cholesterol. So that study kind of, because of the size of it, it's a multi-center study, kind of confirmed all those earlier studies. So a lot of people refer to that study. It's that 2011 VA study. And it just put the brakes on everything. Everybody started thinking, oops, all this statin drug promotion is built, the promotion itself, the reason that a doctor should give you a statin is built on exactly what that study disproves. And that was a problem. So the study got pushed aside. There's no money behind that study because no drug company would help out the VA that found things going wrong for them.
Right.
They're going to push the good studies. The studies they found said that statins are good and you survive longer and the whole thing. However, other people started looking at this and doing the similar studies. And there was a Swedish study. The Swedes ran it, but a lot of American medical hospitals were part of the study. So it was multi-hospital study. And in many countries, that's good because you're getting a big cultural difference. There could be all kinds of reasons and variables why something works and why something doesn't. Why one study says yes and the other study says no. Well, if you make it broad enough and you have cultural differences accounted for and all of a sudden they all come out the same, you got something. And that's what the Swedish study did. It pretty much confirmed everything in the VA study, but it also confirmed one other thing, and that is that LDLs protect you from cancer. And for some reason, they look particularly at cancer in that study, and that's what they found. Now, you should keep in mind that LDLs help your immune system. Now, if you've got a good immune system, that could be a good reason why you may not get cancer. So let's not underestimate the total value of LDLs. It could be a much broader story than just cancer. In 1997, one of these earlier studies, the European Heart Journal started looking at claims that statin drugs were making. And they wanted to know, was it reducing mortality? Was it was it making people with heart disease healthier? And it found that that's exactly what didn't happen. They didn't get healthier. They didn't live longer. It didn't improve their quality of life. Now, some did, but we don't know if they did that because of statins or they changed their lifestyle. I mean, there's a lot goes on when the doctor tells you got heart problems. So maybe you start to lose weight or whatever.
Right.
That could account for some of the successful statin story. And you can't rule that out very easily in a study.
Mm-hmm.
I mean, you could start chopping those people out of the study and you'd end up with a smaller group and maybe it wouldn't be that effective. But, when you have healthy people and they're eating fat and they stay healthy, that tells you something. Now we have a whole bunch of surgeons and cardiac surgeons. And, of course, Stephen Sinatra, I think Dr. Gundry, and there's quite a few. You can watch them on PBS. And they're going to tell you that as cardiologists, they don't believe in the statin story. They don't believe in the low cholesterol story. They're looking at other things. They're looking at calcium in the blood. Calcium belongs in your bones, not in your blood. Causes damage. They're looking at C-reactive protein and inflammation. That's what we're looking at today. And I think that story makes more sense than the cholesterol story.
Mm-hmm.
And remember, there's always going to be someone out there who has some cholesterol issue, out of control, genetic problem, and they're going to have problems.
Mm-hmm.
But they're really not rare, but there are much less of those people than you think.
Mm-hmm.
And there's a whole lot of healthy people out there who I believe are being treated with statins and really don't need to be.
Mm-hmm.
The fact that that concerned them that your cholesterol was 216, and that was a concern to them. You're so healthy. There's nothing wrong with you. And the first thing they're thinking of is, maybe we better treat this.
Yeah.
It's a huge mistake.
Yeah, and she said, watch your diet. Maybe you need to make some dietary restrictions, something like that.
Yeah, but she didn't tell you what to do.
No, and she doesn't know anything, she doesn't know anything about my background or what I eat or...
Well, if there's one thing we know for sure is when the doctor's office starts talking about your dietary health needs, they don't really have a whole lot to give you.
No.
And that's when you go to a different type of professional. You go to a nutritionist or your dietitian, or you go somewhere else to get a little more help.
Absolutely.
That's why we have all these professionals out there. All right, so let me just sum up what the studies have found. And it's pretty much what we said originally. Tiny lipoproteins, very low density lipoproteins, VLDL'S, which can be tested. It's a very easy thing. You put a check mark on VLDL'S on the sheet and they find those in that same blood sample, and you'll know whether you're doing well or not. And it's pretty obvious. Your number is either low or it's high. What about your homocysteine? Well, we need to know what that homocysteine is. That's a real marker of heart disease. Lipoprotein little a, this is a stroke marker. However, most doctors do it on the blood work automatically. You don't have to ask them for it. They don't have to do a check. Well, they might do a check, but it's pretty much part of the standard lipid panel.
Mm-hmm.
You need to have these numbers in case you are having some problem. What is the issue? Is it calcium? Is that floating around in your blood causing the heart damage? All right, need to look at that. Is it VLDL'S? What is going on? Why do you have a problem? Or, my numbers are good. I don't have a problem just because my cholesterol says 235 or something. Perfectly healthy. I have to tell you, I've had some elderly patients well into their 80s and maybe even 90s who had elevated cholesterol. And the doctor suggested treating with statin drugs, and these people have no heart disease. What would be the point of that?
Mm-hmm.
And what would be the dangers? And we're going to talk about that a little bit. But you need to know your triglycerides. So important. Are they under control or aren't they? And the lower they are, the better. It's kind of like the opposite of HDLs. The higher the better. Triglycerides, the lower the better.
Yeah.
You can't get rid of triglycerides, but you can get it pretty low like you did.
Mm-hmm.
And my guess is you were eating a lot of meat at that time.
Yeah.
And very little sugar. Triglycerides can be fixed virtually overnight if you stop eating sugar.
Mm-hmm.
Sugar disrupts the normal metabolic process where we deal with our triglycerides and fat in the liver. The liver gets overburdened with the high sugar diet and can't metabolize the fats in an appropriate way, get rid of them. So obviously low sugar is a good thing. Anybody who tells you it isn't, high carb diet makes no sense. So if you want to stay healthy, keep those triglycerides down. The way to do that is no sugar. So cholesterol, to sum it up again, is life-saving. It's necessary for life. You can't live without it. So you need to give all this a lot of thought if you're worried about your cholesterol, or you should be worried about your heart, not your cholesterol.
Right. Or if you're taking a drug for your cholesterol.
Yeah,
and
yes.
you're not even sure about any of these other factors that you've mentioned, but you are taking this drug, or you've been taking it for a while, you need to go back and you need to ask these questions or look at that data from before.
Is that statin actually correcting my problem?
Right. Did I actually need it?
Yes, that's exactly right. I might also point out, Lauren, that a significant drop in cholesterol is usually an indicator of impending death. Wow. But that's usually in a patient who's already got some problems. But if you had a serious drop in cholesterol, I'd be calling I'd be talking to the doctor about it. Because you make all your hormones from cholesterol. So you could start feeling pretty bad if your cholesterol goes down. A drop in cholesterol means you're not going to be making your hormones appropriately, and then you're going to start feeling bad. Things are going to start changing. So it's important that your doctor knows that and you know that. Cholesterol is also necessary for your neurotransmitter activity. All the functions of the brain are built on fat. Mm-hmm. So cholesterol is important. And your neurotransmitters depend on fat to let the message go through the nerve, messages to the brain, all that. Very important. Build out of cholesterol. Cholesterol's absolutely necessary to keep us from not being depressed, having anxiety, that type of thing. High-fat diets always make people feel healthier emotionally. I have worked with bodybuilders who get into very extreme low-fat diets, and it's not even worth working with them because it's really becomes a psychology or psychiatric case because they can't control their emotions. Mm-hmm. Low fat is very dangerous that way. Emotionally, you can really go off the rails. So that's important. Just brain function in general, trying to stay with it cognitively.
Right.
Very, very important. So simply put, you can't live without cholesterol, and you can't be healthy without cholesterol, and you can't be healthy with very low cholesterol. So the cholesterol story is broad and it's complicated. So for the most part, you just want to keep healthy numbers. And that's why you need to know all the numbers.
Right. Education is power. And
really
this is empowering that we know this and that we can have a educated discussion with our doctors.
This is you trying to stay alive.
Mm-hmm.
And you can't do that unless you have information.
Yeah, it really is. It's a life or death mm-hmm. situation.
Yeah.
Doctors often prescribe statin drugs for high cholesterol. Do they work? Are they safe? Are they necessary in any circumstance that you would actually need to resort to statin drugs, that you couldn't handle it through diet?
Okay, so are they, if they weren't on the market, I don't think it would be that big a deal. Do they work? Yes, they lower cholesterol. is that a good thing for most people?
Right.
And that's what you've got to come up with. Now, the statin itself is an old product. Originally, there was a product way back when I started out in pharmacology, nystatin. It was used for yeast infections. It was probably the original statin. And as you know, health food stores sell red yeast rice, which is a statin, which frankly I never use because it's a statin.
Mm-hmm.
It doesn't have a lot of health benefits.
Right. It could be dangerous.
Yeah, it's very unusual for red yeast rice to hurt anyone. Just doesn't seem to have the same potential side effects as prescription statin drugs because it's a more natural product. And of course, statins, to get a patent, have to put side chains on their molecules. And one thing you'll learn, if you learn anything about pharmacology, it's very simple. To get a patent, you have to have synthesized something so that you can get the patent on it. So it has to be unique. And when you synthesize something, you develop side chains. In those side chains is where we assume the side effects come in. So it's not the same as the original molecule, the natural molecule. It's manipulated so that you can get a patent, and unfortunately it branches side chains, and those side chains are the problem. Mm-hmm. And drugs never make it to the market because of some of these side chains, and some do, some don't. So statins in general, when we look at drugs, if you talk to a doctor, in the back room, so to speak, over lunch or coffee, he's going to say, gee, this class of drugs gives me a hard time. This class of drugs gives me a hard time. Why can't they all be like this class of drugs, which is never a problem, and I don't get callbacks, and I'm not having, patients in trouble. Statins tend to be moderately high in these side effects. Mm-hmm. He gets callbacks, or she gets callbacks. I'm having problems, and I'm going to go through some of the problems. Headache, very common. Sleep disturbance. Now, there's also drowsiness, and I'm never quite sure if the sleep disturbance and the drowsiness are connected,
right?
Or they're two separate
issues.
Because
if you're not able to sleep,
right,
then you're going to be exhausted during the day. And you're
they may
drowsy.
be separate issues. Mm-hmm. Someone just may get drowsiness no matter how much they sleep, and I think I've noticed that.
Well, that's scary.
Muscle aches and tenderness. We'll talk a little more about that. A lot of skin things: skin flushing, irritation, itching, rash. All those things are quite an annoyance and a problem. You can't take the drug with that. Dizziness. A lot of dizziness with statins. Nausea and vomiting. There's a whole lot of GI upset with statins. Abdominal cramping, pain, bloating, gas, diarrhea, constipation. Everything you can imagine with GI issues with statins, they're there. Now, statins carry some pretty severe warnings. They talk about memory loss. Statins will make a person with cognitive issues much worse. Mm-hmm. It's almost a given. Mental confusion, even in a patient who doesn't have cognitive failure, they can get very confused. High blood sugar. We know type 2 diabetes is caused by statins. There's a warning in the package circular. And a diabetic should never be on a statin. And I believe I've seen a few diabetics on statins, so I don't know.
Yeah.
I guess the doctor has to make a decision on how he's going to treat, but for the most part, a diabetic is going to have a hard time with a statin. Statins are associated with some rare side effects that are actually pretty severe and dangerous. Myositis. This is an extreme inflammation of the muscle, so you're going to have a lot of pain. Easy muscle injury if you're trying to do things. We think this is related to it's clearly related to the reduction in the cholesterol, but it causes an inflammation. That's something you do see more often than you think. I mean, I don't know the percentage, but I know I see it an awful lot. And I've seen people come in and say, I want to take red yeast rice because my statin gives me so much leg pain. But the problem with that is you're already into the inflammation. If you take red yeast rice, which is a statin, you may continue with that inflammation. It's best to not take that.
Yeah.
The other thing that you've got to look out for is creatinine kinase. That's a blood test marker. That tells you that you're destroying muscle tissue. That's not a good thing because inevitably it's going to lead to weakness. And then there's rhabdomyolysis. And I can tell you that a few years ago I had a person, was not a patient, was a friend, I guess we'd call him, so someone, associate, something like that, who had been in braces, and I assumed they had Guillain-Barré syndrome. Here, they had rhabdomyolysis from a statin. They only had taken the statin about 6 months and developed paralysis, literally. Their muscles were so weak in the legs, and spent, I believe, 3 years in braces. And the day I saw him, he was celebrating not having the braces, but he's still walking with a cane.
Wow, that's terrible.
Now that's an extreme. That's an extreme case, but it's out there.
Mm-hmm.
So this can be a pretty bad drug if it gets out of, if you get those side effects. And then there's the kidney damage thing that goes along with that. And remember, these inflammations are destroying or hurting muscle. Your heart's a muscle. And there's some evidence, if you read the studies, that since the introduction of statins, there has been an increase in congestive heart failure. What is congestive heart failure? It's a weakening of the heart muscle. Why is congestive heart failure on the rise if statin drugs are doing us a favor? It could be that statin drugs are hurting the muscle itself and you develop congestive heart failure. And this has been an argument now for a while. If we put a young person on a statin, which is what all drug companies want us to do, what are they going to look like when they're 65? Are they going to have congestive heart failure? Are they going to be able to function? Or are they going to have to sit in a chair all the time?
Mm-hmm.
And on the other end of the spectrum, you don't want to give extreme elderly people this because maybe their hearts are starting to get weaker.
And their muscles.
Yeah.
Yeah.
So, got to be real careful with statins. It shouldn't be the first drug as it is now.
Mm-hmm.
There were other drugs for lowering cholesterol. The niacin prescriptions are out there. You can use niacin by itself. It might lower your cholesterol. There were fibrous type products, fibrinates, I think they were called. In fact, I worked for a company that made one, and I just never worked on it or anything. These can lower cholesterol. You hear that oatmeal story. Eat oatmeal, you'll lower cholesterol. Unfortunately, the studies show that it only does about 3%. Not effective enough to be, maybe that's even significant. I don't think it is. But you're not going to help yourself lowering your cholesterol 3%. It just isn't going to matter. If you need to lower cholesterol, you need to really lower it.
Yeah.
Question is, are you that person? Did we do the testing? So basically, today we're here to talk about other ways to lower cholesterol.
Yes, let's talk about natural ways that you can deal with cholesterol.
Okay, so earlier I mentioned olive oil. Olive oil is extremely important. Olive oil and avocado oil. These monosaturates are very good for raising HDL, and they're good for you overall. So that's important. If you're using junk oil, corn oil, if you're reading, canola oil, awful. I can't tell you how many people come in and tell me how wonderful canola oil is. It is not.
Cause some serious health issues
Oh my gosh.
in your body.
Palm oil. We have a world full of wonderful olive oil.
Mm-hmm.
And it's the healthiest thing out there. In Europe, there are shops where they make everything out of olive oil. Soaps, creams.
Sounds like heaven.
Foods, there's so many things you can do with it, and these olive shops just keep doing it, and it's so good and it's so healthy for you.
Right.
But olive oil is just an amazing product.
Yeah.
And a very healthy product. So that's something you want to start with, along with exercise. Stop smoking, reduce drinking, more exercise. Let's start there. Now, the next thing you can do, if you're still having problems and you need to lower cholesterol.
Right. And by the way, these things aren't going to have side effects. They're not going to have awful side effects. They're going to have
Side benefits.
they're
That's
going to
what we
have
call them.
side benefits.
Yes, and
which,
we'll talk about the benefits
yeah,
also.
It's amazing.
Yeah, so the first thing I want to talk about, and when you go to the website, you'll see it. The Now brand has a plant sterol. There's sterols and stanols. Sterols are this waxy substance on the stem of plants. It breaks down cholesterol, helps your liver get rid of it. And it can lower your LDLs or your VLDLs. Beta-sitosterol is the Now product that we have on the website. Beta-sitosterol. Very often you take this and your cholesterol issues are done.
Mm-hmm.
And you take it, you're just starting, right? You just got the bottle, your cholesterol, your doctor's giving you a hard time about your cholesterol. So you take one with each meal. Doesn't matter if it's before or after. Just take one with each meal. You go back 3-4 months later and your doctor does the blood work, it's either going to come out, he's going to go, wow, you got it where it should be, or it's, going down even lower, or you didn't get to where we need to get you. That part we'll talk about in a second. If everything's okay, it's time to not take a beta-sitosterol with every meal. You might just want to take it with breakfast and dinner or lunch and dinner. You may just take one a day and see if it holds you. So you got to play the game with this up and down. We call it titrating the dose and figure out what holds you. But the odds are you can probably lower that dosage once you get to where you need to be. Nice thing about beta-sitosterol, in particular, if you're a man and your doctor has told you that you have elevated cholesterol and he wants you to lower it, and you have an enlarged prostate, this is the perfect product for you. Believe me, this happens a lot. This is not uncommon. So I will actually choose beta-sitosterol for that patient because it really works great on the prostate. It'll shrink the prostate and make the person feel a lot better. Sorry, women, we don't have an angle for you on this one. We'll work on something else. But beta-sitosterol, great introduction product for this. Another product that could be a standalone product, phosphatidylcholine. We use, on the website, we have Thorne's phosphatidylcholine. You do it the same way. You take one with each meal. And after 3 or 4 months, you get your blood work done. And if everything's okay, you start stepping it down, titrating it down, and see if that holds you. Now, let's go back and say, maybe with, let's say the beta-sitosterol didn't get you to where you want to be or where your doctor wants you to be. You can add phosphatidylcholine. First of all, they're both healthy for you. They'll make you feel great. I was director of an ADD center. We have patients that had ADD, children and adults. And phosphatidylcholine is exactly what you need to focus and think better. Now, that can work even on a patient that's showing cognitive failure. It's a fat that helps your neurotransmitters work better. So if you have a situation where you have some cognitive issues and you have high cholesterol, hey, this is a great product. Mm-hmm. A little different than the...
Kill two birds with one stone.
Exactly. It's similar to what we did with the sterols. Mm-hmm. The other thing about phosphatidylcholine and why it really might be a base product for all treatment of cholesterol is that it makes your liver work better. In fact, it's a great fix for alcohol fatty liver disease or just fatty liver, non-alcohol fatty liver disease. It will make, let's say you have elevated enzymes, it will bring those enzymes down. In doing so, it's also making your liver process fat better. Mm-hmm. So these two products, sterols and phosphatidylcholine, great products to work. That's a good starting place for anybody. Also, another product on the website, Allergy Research, we have panathine. Now, panathine is a good product if you're having trouble with your blood sugars or you don't handle carbohydrates well. So panathine could be an add-on to a sterol or even by itself. If you tend to have, if your, let's say, triglycerides are constantly elevated, this may be another way to try to bring that down. Mm-hmm. So panathine is important. And panathine can be 1 to 3 a day, but usually 1 a day is what the dose usually is. Now another product, and this has some advantages, berberine. Berberine is a good product for lowering cholesterol, but it's a great heart product. It does a great job for the heart. And if you're diabetic, it works just like metformin, and it lowers your blood sugars. So if you're in that category, berberine is a good choice. Now we have Berberine Balance by Douglas Labs, professional company again. That has alpha lipoic. So if you're diabetic, you may know what alpha lipoic does. It protects you from neuropathies, and it protects you in a lot of ways if you're diabetic, including your eyes, and that's a serious thing. Grapeseed extract is in the Berberine Balance. Grapeseed extract keeps the arteries healthy and clean. So good combination product. I've been using this product for at least 20 years. It's a wonderful product. Now, new on the scene, bergamot. This is a citrus derivative. Bergamot is a great product, a little like berberine, particularly good for diabetics, and just lowers cholesterol very effectively. We have a garlic by Pharmax. This is really intense garlic. If you have high blood pressure, garlic might be a good choice for lowering your cholesterol because it'll lower your blood pressure also. Maybe garlic with phosphatidylcholine could be a real effective way to deal with this. If you're having peripheral artery disease, that meaning that the blood vessels in your legs and the extremities aren't working very well, we have a product by Phenex called Arginine Complete. This is a high arginine citrulline product with grapeseed extract and a whole lot of other things in it. This is kind of a morning juice product. You take a scoop, put it in some water or juice, stir it up, and that's it. You're done for the day. This is an amazing product. It will lower blood pressure, so keep that in mind if you're on a blood pressure medication. You may end up using less blood pressure medication, but it will create blood circulation, which is extremely important. It kind of cleans the arteries. It's just a pretty good product if you're having that kind of a problem. And a lot of people have peripheral artery disease. Unfortunately, in this era we live in, everything's initials. Yeah. So people will be talking about PAD, and nobody seems to know what PAD is. It's, I have PAD. Well, what is it?
Right.
And here's the sad part. I'm bad at initials. If you don't spell it out for me, I don't always get it.
Me too. I need it spelled out.
So peripheral artery disease means the arteries in your legs are probably shutting down, giving you pain, neuropathy, and all kinds of discomfort. Arginine Complete, that's a great product to deal with that and lower your blood pressure a little. And honestly, unless you go very low, low blood pressure is clearly preferred above high blood pressure. So you should work on your blood pressure. Ubiquinol. We all talk about coenzyme Q10. Nobody's using coenzyme Q10 very much anymore because ubiquinol has come out and it's a better form of coenzyme Q10. It'll lower blood pressure, it'll lower your cholesterol, it's good for your brain, it's good for your heart. If you have congestive heart failure, let's say you have mild congestive heart failure, ubiquinol helps with contractility and makes the heart push blood around a little better. So it's great for that. It's also a great immune builder. We have Protocol for Life. Coenzyme Q10 and ubiquinol are patent items. They're owned by one company. So as a result, they don't actually sell it themselves. They license it out to other people. And those people will set the price. Some people set it high and some people set it low. It's all the same product because it has to be done exactly to their patent. So, and a lot of it is made by them that you find in the store. So Protocol for Life's a wonderful lower priced ubiquinol. So why pay more? So we have that on the website for you. I talked about fish oil earlier. We have several fish oils on the site. We have a liquid, we have capsules, we have a phospholipid fish oil version instead of the triglyceride form. But it's omega-3 plus by Europharma. And this is a 1 a day. And that's a really good choice. Very good if you have some cognitive issues, I'd recommend the omega-3 plus. If you just have elevated cholesterol or triglycerides, I would use the Pharmax fish oil, either the liquid or the capsules. So we have a good variety there. If you have elevated homocysteine, that's very specific and, by the way, extremely easy to fix. And doctors have been doing it for years. You use folate. Folate is the natural form of folic acid. Folic acid just doesn't work in everybody. Folate works in everybody, and that's due to a methylation issue. Many people have this methylation issue. I discovered just lately I have a minor version of it. So I tend to, of course, use folate. It's the best way to go. It will lower your homocysteine and protect from heart damage. And we have a wonderful folate on the website. If you have heart problems, we have a folate with a B12 in it. B12 is very good for heart problems. So think about which one is going to make more sense for you. If you're active, you don't have any issues with B12 deficiency, that type of thing, you just need plain folate. If you're weak and you're just not doing well, B12 is probably the way to go. And your doctor should be able to tell you that from blood tests. He could say, your B12 is kind of low. Well, take a folate, and we have it by Jarrow, and it's in a lozenge, real easy to use. That's a real good thing. Now, a key one that you really have to pay attention to is that calcium blood level. If calcium's in your blood and it's high, you need to work on that quickly. There's only, again, similar to the folate situation, one thing that works for it, and that is vitamin K2. Not K1, but K2. Now, if it has a little K1 in it, that's fine. Our product is just K2. This is important. If you're on a blood thinner, you can't take more than 150 micrograms of K2. So this is formulated exactly where you need it, even if you're on a blood thinner. You can take one of these a day. If you're not on a blood thinner and you do have elevated calcium in the blood, you want to get it out of there quickly. I would take 2 of these a day till you get that level down. And you might even need more, but you be conservative about it, but start with 2 a day. Get that calcium out of your blood and it'll stop damaging the heart. So that product is by Biotech, by the way. And that's another wonderful professional company. I think we have a sale on that. There's a special price on that. You need to know that number. So get your blood work out, call your doctor, find out which one of these he did or she did, and see what you need to work on.
Right.
So that's kind of what we have. We hope you go to the website, earthfoods.us, and look at these products. I think we've given you pretty much enough information on how to use it and when.
Yes.
And you can always email us at the website.
Yep. So
we are always answering questions.
We would love to help you out. You can get in contact with my dad if you go to www.earthfoods.us, and then you can contact him there, and you can send him an email and set up a consultation. And you can find all the supplements that we mentioned on our website, again, www.earthfoods.us.
In fact, look for the cholesterol button at the top of the page, or it'll say cholesterol support, I believe. Click on that, and you'll see every product we talked about today. And we try to find products that are reasonably priced or really good quality.
Good quality, yes. So thank you guys so much for joining us. Thank you, Dad, for being with us
Lauren,
and giving us that incredible information that we can pass along to our friends, that we can use to empower ourselves and to be able to have a better conversation with our doctor and just understand how our bodies work better so that we can be healthier and live longer lives. Thank you guys for joining us.
Thank you.